thank you all for joining us for Early Detection Advantages for Chronic Kidney Disease, brought to you by our friends at BasePause. My name is Stacy Cruz, and I will be your webinar host for Fear Free this evening. Presenting today will be Dr. Ashlie Saffire, and tonight's presentation is race approved for 1 CE credit. Again, some quick housekeeping before we begin. There are 2 options on your Zoom control: a chat feature, which will let you chat with anyone in the audience, and then that question and answer box. At the end of the presentation, we will have time to address questions, so please use the Q&A box so I can keep track of our questions and I don't lose it in the open audience chat. Race certificates for tonight's presentation will be emailed to attendees within the next 7 days, so please be sure to check your email for those certificates. We are going to go ahead and get started. We have Dr. Ashlie Saffire joining us, a graduate of The Ohio State College of Veterinary Medicine, class of 2011. Ashlie is board certified in feline medicine since 2018 and has been practicing in Columbus, Ohio, where she specializes in feline internal medicine and management of complex disease processes and disorders. We are so excited to have Dr. Saffire here with us. So on that note, I'll pass it over to you and we'll go ahead and get started.
Yay, thank you. I'm so excited for our talk tonight. This is going to be really exciting stuff. I'm very excited to share some new research that BasePause by Zoetis has been working on in the topic of CKD, which is a really important disease for anybody who takes care of cats, especially myself, a feline practitioner. It's one that I'm very passionate about. I'm also really excited to share how fear-free techniques can help to get your feline patients into the hospital and into the clinic to help you take advantage of some of these new early detection modalities. So our learning objectives tonight, we're going to start by having a discussion about what are the obstacles that are keeping cats out of our clinic. And then we're going to have a quick review of kidney health and disease in cats, followed by concepts of genomics, the microbiome, and opportunities that they present for personalizing our approach to medicine. I'll use polycystic kidney disease as an example of a simple Mendelian genetic disease and compare that to the complexities of most cases of chronic kidney disease that we see in our patients. We'll then close with an introduction to some current research into genomics and the oral microbiome of cats with chronic kidney disease and how you as a practicing veterinarian can be part of this cutting edge research and reap the benefits for your patients. So first, we're going to talk about the cat inside its natural environment. So cats by nature are skilled hunters with a heightened sense of smell, hearing, vision, and tactile response. They're a solitary survivor, and they have an excellent ability to sense and avoid danger. So by nature, they hide their illness and pain as a survival mechanism. They are territorial animals that require a sense of control, safety, and familiarity in their physical and social environment. So what happens to that cat outside of its natural environment? Well, this is, for example, a cat's trip to the veterinary clinic. So when we start at home, the cat is put into a carrier. They're removed from their familiar environment. They experience unfamiliar olfactory and auditory stimulation at the vet clinic. This then is followed by them usually being separated by their family. They're often restrained, and in some cases, they might not receive appropriate analgesia when experiencing pain. So when we're removing a cat from a known territory and taking it to an unfamiliar place like this, we're giving rise to protective or negative emotional state and increased distress in our patient. Additionally, the stress from the vet clinic can lead to changes in its physiologic parameters, leukogram or biochemistry results like high blood sugar, cortisol levels, and behavior of the patient that potentially might lead to inaccurate exam findings like high blood pressure. So this frustration or fear anxiety system can also be triggered when a cat feels that it doesn't have control over a situation, which would include when they're being restrained for an exam or having a diagnostic procedure performed. So what does this have to do with kidney disease? Well, if they're not coming into the clinic, then there's no way to diagnose kidney disease. The overall cat population in the United States has increased over the last decade, and actually 26% of households now currently have cats as pets. However, there's been several surveys that have done over the last couple of years that have identified that these pets are actually not being seen by their veterinarian for routine care. In 2014, Bayer did a usage study, and they found that only 52% of cats, or they found that 52% of cats had not visited the vet in the prior year, and only 37% of cats visited the veterinarian for routine exams. So fear and anxiety that was associated with travel, resistance to pet carriers, and a stressful experience at the vet clinic were main contributors of avoidance of care in this study. So lack of knowledge of the importance of routine exams and the cat's ability to hide signs of illness or injury, in addition to the cost of visits, were also found to be some contributors. So with this evidence, knowing that the cat population has increased, we have got to find a better way to get these cats in our hospitals. Well, what about caregiver welfare? Well, some studies actually found that there's a negative effect of welfare on the caregiver as well. A survey done by Caney in 2022 found that 89% of caregivers felt their cat's welfare was impaired before, during, and after a vet visit. And 94% of the responders felt that witnessing stress in their cat was actually stressful for them. So this is a really important thing to note. And ultimately, a third of these respondents would avoid taking their cat to the vet clinic altogether unless there was an emergency situation. So not only do we need to worry about the cats and their fear, but we need to worry about the caregivers as well. So what do we do about this? Well, let's start talking about the Fear-Free initiative. And Fear-Free certification, for those of you who are unfamiliar, is a really great education on how to address the emotional well-being, the enrichment, and the reduction of fear, anxiety, and stress in pets, and to improve the experience of all the humans involved and the pets involved when they come into the veterinary clinic. What are the benefits to Fear-Free certification? They are so many. That reduces and removes anxiety triggers that we know can cause pets to become fearful, both at home and during transport to the clinic, and then when they get to the clinic. We can help owners deliver calm pets to the hospital. We enhance the quality of medicine. So again, when we do our exams, we're getting thorough exams, we're getting more accurate test results, and everybody who's part of that cat's care, including the veterinary staff members, are all safer. So some examples of fear-free tactics would be utilizing pheromones in the home or in the car, and then again at the vet office. We're really big proponents at our clinic of sending home the Feel Away pheromone wipes. An owner can wipe the inside of the carrier before they load that cat in. And so then they're already basking in these nice pheromones by the time they get to their clinic. We also offer towels in our waiting area for the owners to spray with fresh pheromones and lay over the carrier. Sometimes placing the carrier in the car in a secure way and leaving them there until it's time for their visit, where we can bypass the waiting room altogether and take them straight to an exam room, is another really great way to lower the stress and be more fear-free. Also, make sure when we're carrying that carrier that we're carrying it securely with a hand underneath it. We don't want that carrier to swing while we're transporting the cat, as that's just going to increase fear for them. So now you're a fear-free certified clinic, fear-free certified practitioner, and patients are coming into your clinic, more feline patients than you've ever seen. So when's the ideal time to do lab work in these guys? Well, we all know benefits of annual diagnostics, right? It establishes healthy baselines. It allows us to monitor trends in our organ function and helps us to diagnose disease much quicker, such as kidney disease. We all want to catch kidney disease in stage 1 or stage 2, and we can actually do something about it and help our patients to actually live longer. But how do you convince owners of how important blood work is every year? You know, I typically hear, oh, doc, he hasn't lost any weight. He's urinating fine. I know he's fine. And it can be really hard sometimes to talk an owner that, you know, we need to really do some screening on this cat and look for some early kidney disease. So what if there was another type of screening that didn't involve venipuncture, that was feline friendly, fear-free, and very relaxing for the owner? Do you think that that might increase the compliance? Well, when's the ideal time? That's the first question we need to answer. For those of you who aren't familiar with the 2021 AHA and AASP feline life stage guidelines, I definitely encourage that you take a look at these. There's 4 main age-related stages that are discussed, from kittenhood all the way up to seniors. And what they do is break down based on age and what likely diseases there are to develop, what are the baseline data that you should be getting in your hospital, helping you to detect unapparent clinical disease. And sometimes these are single baseline bloods. Sometimes these are repeated at intervals based on the need of the individual cat. But it's a really great place to start to help you build when you should be taking labs or when you should be doing any kind of diagnostics on your feline patients. So this is a good question, time to kind of stop and think for those of you who see feline patients. How often are you doing blood work on them? Do you follow these guidelines? Do you make any recommendations for annual diagnostics? And I actually ran a quick survey in my practice about 2 months ago and just looked at how many annual exams, for example, that I saw in that month, and how many of those patients did I do some kind of annual diagnostic blood parameter on. And these were not sick patients, these were healthy. And my number was actually 86%, which I thought was quite high, actually. The following month I only got 80%. So I probably ranged between 80 and 85%, which I thought this was pretty good, but certainly room for improvement because we should be getting diagnostics on everybody. And so with that, and me being a feline only practice, I do have concerns that maybe some of you who see dog and cat together, maybe you don't get as much compliance, or maybe you do. So it's a good number to or good thing to do is sit back and look at that and kind of see where your compliance rate is. So when it comes to doing these routine labs, what do we have? What are our tools for routine monitoring when it comes to chronic kidney disease? Well, we know there's traditional renal biomarkers. Those can be really helpful, but they do have limitations. There's newer tests out there now like SDMA and Renal Tech, and they're attempting to bridge this gap in diagnosis, but we're still operating with a blindfold a good percentage of the time in our patients. Even those cats who receive lab work every 6 to 12 months, there is a delay between the initial loss of nephrons in early kidney disease and our ability to detect this on lab work. So what are those early detection benefits? Why do we want to pick that or find these diseases early? Well, as a feline practitioner, I see a lot of very sick cats. The toughest cases are always those ones that come in, they haven't been to a veterinary clinic in 10 years, or maybe since they had their kitten vaccines, and they look terrible. They have weight loss, they have cord muscle condition, they might have terrible stage 4 dental disease. Then we run lab work and we're like, great, you also have stage 4 kidney failure. So how do you know which disease came first? Which is the bigger problem in these patients? And it's a tough reality that if these caregivers had brought their pets to the clinic sooner, we may have been able to address the dental disease sooner, or we may have been able to detect that kidney disease when it was earlier, like stage 1 or stage 2. So early detection is imperative. It helps us slow progression of disease so our patients live longer. It helps them to maintain an ideal body condition. It helps them to maintain dental health. So lots of really important things. So here's a point for consideration that ties us into why we're all here tonight. What if genetics and the oral microbiome testing could be used to identify potential risk factors for the development of periodontal disease and chronic kidney disease in our feline patients? Well, I'm really excited to share a new screening tool for CKD and periodontal disease that's currently being developed that involves a non-invasive oral swab that you can see there on the slide, that evaluates the genetic predispositions, the health markers, and the oral microbiome of our patients. This is what a cat's genes are telling us about the cat. It's reinforcing recommendations for lab work monitoring or dental prophylaxis procedures. So another question for you, for that percentage of caregivers that decline annual diagnostics, or in my case, at 20%, do you think that they would be more compliant if they knew their cat was at higher risk of developing CKD based on genetic and oral microbiome information in addition to your medical recommendations? And I'd have to think the answer to that is probably yes. So briefly, we're going to review a little bit of feline kidney physiology and disease. Since we're all, most of us here, I think, are veterinarians, I'll make this pretty quick. So cats have a remarkable ability to concentrate their urine when they're healthy. And so the nephron that you see in this figure is the functional unit of the kidney. Every feline kidney has around 200,000 nephrons. So as blood arrives to the kidneys via the afferent arterioles and the process of filtration begins at the glomerulus, about 20% of plasma goes into the kidneys, and then fluid and electrolytes are reabsorbed at that proximal convoluted tubule, in addition to glucose and some amino acids. And then water-soluble waste products, which are of no use to the patient or the body, stay in the filtrate and are excreted in the urine. Then comes the loops of Henle, which are very long in cats. And this is what allows cats to have such a good concentration ability. And then from there, the blood returns to the body. So as kidney function deteriorates and fewer functioning nephrons exist in our patients, that homeostatic mechanism struggles to regulate fluid. We have loss of electrolytes. We have an upset mineral balance. And then the hallmark feature of chronic kidney disease, which is that loss of the ability to concentrate their urine. So let's talk about prevalence of chronic kidney disease in cats. How common is it? Well, we know it is, but what are the actual numbers? So the ISFM consensus statement published in 2016 on CKD, they reported that 30 to 40% of cats over the age of 10 are diagnosed with kidney disease. Another study that was done looking at primary care practices in the UK by O'Neill in 2015 found that kidney disease was the most common cause of non-trauma related death in cats over 5. Another study at NC State that was published in 2014 by Marino et al. Found that 80 to 86% prevalence rate of CKD in cats over the age of 15. So why are we seeing so much of this disease? Is it because cats are living longer and their kidneys just can't live forever? Is it natural consequences of ages? So let's look at some of the causes. So there's a lot of different causes that we know of that exist. And in 2016, there was a review done in veterinary pathology by Brown et al. And they found out numerous factors that have been proposed as possible causes or contributors to CKD. This includes renal dysplasia, polycystic kidney disease, amyloidosis, immune complex glomerulonephritis, unbalanced diets, and acute kidney injury. What they found, however, was all of these causes were still pretty much considered rare or very uncommon. And so what that left us with was the vast majority of these chronic kidney disease cases that we see are in general practice are actually considered idiopathic. So when we have a common idiopathic disease, then it's important to remember that there's multiple factors that are likely involved. This leads us to consider the cat's genome, the oral or microbiome of the body, and those products of the microbiome, as well as the environmental factors. And this could include anything from diet to medications they might be on, and then the molecular process of aging as well. So how can we use those different factors then to help us to identify at-risk patients for developing CKD? Well, in the last decade, advances in data science have improved our ability to dissect complex multifactorial relationships and learn a lot more about this. So I'm going to introduce you to a concept of personalized medicine. According to the NIH, they have a National Human Genome Research Institute, and they define personalized medicine as an emerging practice of medicine that uses an individual's genetic profile to guide decisions made in regard to the prevention, the diagnosis, and treatment of disease. We're going to expand this definition tonight to include the microbiome profile of the patient as well. So we're going to define a few terms before we move any further as a refresher. So the term genomics means the study of all of an individual's genes or their genome, including the interaction of those genes with each other and the person's environment. The microbiota, this is the community of microorganisms that are characterized by taxonomy and abundance that are living in a given environment. The microbiota includes viruses, bacteria, archaea, and microscopic eukaryotes such as fungi. The microbiome, this refers to the genetic material of the microbiota that we can observe and quantify the genetic material of organisms in a microbiota rather than the actual organisms themselves. And a lot of times microbiome is used to mean microbiota. So we're going to move into the genetics of feline kidney health. So circling back to those causes that we discussed before, there's a number of processes like polycystic kidney disease, renal dysplasia, amyloidosis that can lead to CKD. But again, like we had said, most of these cases are considered idiopathic. Well, polycystic kidney disease is common in Persians and Persian-related cats, and this is a nice example of a simple Mendelian genetic disease, whereas idiopathic disease has multiple factors involved, such as the genome, the microbiome, the environment, and the process of aging. So how can polycystic kidney disease be a good example? Well, we know that PKD is caused by a mutation or variant in the PKD1 gene. This variant follows an autosomal dominant mode of inheritance with complete penetrance. Autosomal dominance means, as you all remember, I'm sure, that cats need only one copy of the variant to manifest disease. And then complete penetrance means that any cat who has that variant is expected to manifest this disease. So how common is polycystic kidney disease? Well, Schur et al. Reported a prevalence of 38% in Persian cats in the United States, with a similarly high prevalence in other geographic regions. Well, BasePaws also screens for this variant in their feline genetic test, and they've observed an allelic frequency of 0.25% in the total population of cats screened. So what this means is that although very common in Persian and Persian-related cats, the PKD1 variant is actually relatively uncommon in the total population of cats. So most cats who develop chronic kidney disease do not actually have PKD. Well, what would be the benefits of screening for a genetic disorder like this? Early detection, of course. This is going to allow us to implement stringent monitoring, blood work, blood pressure monitoring, urinalysis, potentially some imaging. It's going to then allow us to intervene earlier and then potentially remove some of these cats that may be positive for these genetics from a breeding program. So why study the microbiome then, on the other hand? Well, genetic material is only one aspect of an individual's health. The total health of our patients is determined by the interplay between their genome, the environment, and their microbiome. So our understanding of the interaction between the genome and the microbiome is growing rapidly, but there's still a lot for us to learn. What we know so far is trillions of bacteria live on and in our feline patients. These bacteria are actively growing, they're consuming nutrients, they're producing molecules, they're interacting with their fellow microbes, and all of these activities going on can impact the host. When we're studying the microbiome, it's important not only to identify certain species, but to understand that all of the species, or understand all of the species and their relative abundance to one another in our patients. So in the last 2 decades, we've seen dramatic improvements in the accuracy of sequencing technology of the microbiome, coupled with reduced time and cost of these techniques. And as a result, this research field is rapidly growing. So by defining a microbiome pattern in a particular patient during a disease state and not during a healthy state, we're actually able to identify a couple things. First, a potential diagnostic or predictive metric for a disease. We can identify an area for future research to better understand the relationship between the microbial community and a disease. And we can also identify targets for prevention and therapeutics. And at this point, it's critical still to note that we don't leap just yet from correlation to causation to intervention just yet, but it is something that we can think about in the future. So we're going to talk a little more about oral microbiota, what we know so far. And we know that it has the potential to influence the host in several different ways. It's no surprise that microbiota affects the periodontal health of a patient. In people, there's a ton of research going on right now in this department, and we know that certain bacterial species are known contributors to dental caries and periodontal disease, and that's in both humans and animals. And we also know that other bacterial species are actually thought to promote dental health. Additionally, the presence or the abundance of certain bacterial species can correlate with development of some oral cancers, including squamous cell carcinoma and some distal alimentary cancers, such as esophageal carcinoma. And lastly, patterns in the oral microbiome have shown to correlate with autoimmune diseases, systemic cancers, and neurologic diseases. And in some cases, a direct relationship has been suggested due to the presence of bacteria or their molecules at the site of a disease. So in cats, as in cats, CKD in humans is also pretty common and unfortunately underdiagnosed. And there's a growing body of research in humans right now that's connecting the microbiome to kidney health and disease. A healthy microbiome, and specifically short chain fatty acids, which you can see there on the slide, those are produced, they're produced by beneficial microbes, and they've been shown actually to reduce inflammation in the kidneys and actually be preventative and protective. They can regulate blood pressure and they can promote the health of the intestine. When we have dysbiosis, we have bacterial products such as TMAO, indoles, and ammonia, and these are going to contribute to uremia. They're going to worsen kidney inflammation, and they're going to eventually lead to fibrosis. So while most of these studies have been actually looking at gut bacteria in humans, diagnostic patterns have been identified in oral bacteria that correlate with kidney disease and have been suggested as a non-invasive diagnostic tool. So how does oral microbiome sequencing actually work? So first, it's important to understand that the vast majority of microbiome research demonstrates correlation, not cause and effect just yet. So for example, when we have increases in certain bacteria that are noted in the oral microbiome of humans with CKD, we can't conclude that those bacteria are causing kidney disease, but we can see that signature there. I think a good example that you can probably relate to would be when we have a cat with an upper respiratory infection and we run a PCR test and our results come back and they're positive for herpes and mycoplasma. Well, we don't know for sure that those two organisms, although present in the sample, are actually causing the disease, but we do know that they're there. And so with that information, you have to decide, is that the primary cause or not? So why we can't make the connection of cause and effect, there's just so many scenarios that could explain both indirectly and directly an increase or decrease in certain bacteria with kidney disease. So instead, we're just trying to identify patterns like a microbial signature that coexists with a disease state. So this diagram shows the collection of saliva from the patient using a non-invasive oral swab, and then shotgun metagenomic sequencing is used to identify bacteria that are present in those oral samples, coupled with bioinformatics analysis. This is where the DNA is separated and quantified. And then the output of this analysis is compared against a feline oral microbiome database that contains samples from healthy patients and cats that are suffering from different conditions. So BasePaws has been working over really the last several years to collect a microbiome database. And so far they have healthy cats, cats that have disease, they have periodontal disease, and they have chronic kidney disease patients in their database. And they've been able to identify a predictive microbe whose compositional abundance is associated with each of these conditions. From there, they're working to develop a risk score system for each of those conditions. So here's where the exciting stuff is. I know a little bit of that can be dry getting through it, but this is what the research and what the data is showing us. And this is where I get very excited. So after preliminary analysis on about 180 oral microbiome samples from cats with CKD and about 3,000 healthy cats that have no known systemic diseases or evidence of dental disease, they were able to develop a predictive logarithm that calculates the probability of cats having CKD with high sensitivity and specificity based on the state of the oral microbiome. This test isn't quite yet available because there's still more data needed to fully develop the risk test, but let me show you a little more of what we've got so far. Not sure what happened there, sorry guys. So after sequencing in computational analysis, BasePaws has identified specific microbial signatures that are associated with periodontal disease, and that is the red circle that you see in the graphic. And then they've also identified microbial signatures associated with chronic kidney disease, and that is the green. And so you can see that there is significant overlap there in the middle. In fact, there's 87 microbes that were present in both the CKD and the periodontal disease cats. And this large overlap of organisms in the mouth is not surprising. There are, however, 23 unique species that are predictive of CKD that don't predict periodontal disease. And you can see that in the area in the green that is not overlapped with anything. And so what's important to note that although there are 87 species in common with these two predictive models, it doesn't mean that periodontal disease causes kidney disease, but the relationship between dental disease, kidney disease, and other ailments has long been suggested, and this definitely warrants further investigation in the research department. It's also important to note that this data doesn't demonstrate that a healthy mouth would prevent kidney disease by any means. So here's another graph. This is showing the overlap between predictive microbes and different conditions that are associated with the lower urinary tract disease, or different diseases, and then CKD. So at the top, you can see CKD listed. And then following that is urinary calcium oxalate crystals, cysteine urinary crystals, struvite urinary crystals, and then idiopathic cystitis. So while different conditions of the urinary tract and the kidneys have some overlap in their predictive microbes, there's also a large amount of disease-specific signaling that can be identified through oral microbiome analysis. And I think this is where it starts to get really cool. So here's an independent cohort validation of BasePaws' CKD oral microbiome-based risk detection model. Both cohorts that are in this study were citizen science data, but they have medical records to support them. So what we know is that those cats that are in the CKD cohort, they have been diagnosed with CKD. And then those that were designated as healthy have medical records from the past 6 months that are confirming the health status of those patients. And so what this figure shows is that the BasePaws model is actually able to distinguish between cats with CKD and healthy cats and assign a higher CKD risk score to those cats with a confirmed CKD diagnosis. So here's another table that you can see that is a snapshot of the BasePaws early clinical sample validation efforts. And this is demonstrating the test potential to detect CKD at stage 2 in its current version. So in this particular graphic, there's 5 cats that have confirmed CKD diagnoses, and they were recruited through a partner veterinary clinic. And you can see that the cats with stage 2 CKD, which is cat 1 and anonymous cat 1 and anonymous cat 4, they fell in the higher risk assessment range, which is the red and the yellow bar, compared to the stage 1 cats, which fell into that green bar, and that's considered low risk. BasePaws has a very active clinical recruitment program for cats with CKD right now, and they're aiming to recruit a gold standard cohort to validate and optimize this prediction model. We'll talk about this more in a couple of minutes, and how general practitioners can help to collect data and get us some more information, because hopefully with time, we actually might be able to make this detection test even more accurate for stage 1 patients. So why evaluate the oral microbiome? The value is simple. We're identifying risks for CKD earlier, we're diagnosing CKD earlier, and we're able to improve access to care for all cats. So how do you get a sample, and is it fear-free? So utilizing a very considerate approach, a touch gradient, monitoring fear, anxiety, and stress while you're using the swab, and overall creating a positive experience while you're handling the patient, such as offering treats or high-quality snacks following sample collection, you can naturally create a fear-free sample collection for the patient. And up there at the top picture, that is a cat named Lexi who was getting her swab done at home. And you can see she really didn't care that the swab was going in the corner of her mouth. Very gentle, and it's pretty easy to get. Additionally, what's nice is this testing can be done at home. Oops, sorry about that. Skipped ahead. So you can do these tests at home, but you also can do them in the vet clinic, and that's the other photo in the picture. And again, it's very gentle. It's very easy to do, and I have actually done a lot of these swabs in my hospital, and it's very easy. The cats truly don't mind at all, so it's a really easy test. So an example of how the oral microbiome screening test might help measure CKD or manage patients with genetic mutations for polycystic kidney disease is shown here. So the saliva swab would be taken either at home or in the veterinary clinic, and then it gets sent off to base pause. A few weeks later, about 4 to 6 weeks, that report is going to be shared with the veterinarian, and it's going to offer what risk factors this cat has. Is it positive for a PKD gene, or is it considered moderate to high risk for CKD? So when we get that test result and it's telling us our patient's at high risk, of course, this is where ideally we're catching them in a pre-symptomatic stage. And so now knowing this information, you can report back to that owner, we really need to do more annual diagnostics or bump up our screening of this patient, get them in maybe biannually for exams, and you're going to get more compliance from that owner because this is something that cat's genetics are telling them. Here would be an example of using the oral microbiome test for oral health, and it also can help to predict periodontal disease, tooth resorption, and coming down the pipeline stomatitis. And so again, the swab is taken either at home or at the vet clinic. The report is shared with the veterinarian, and then a test that reports high risk factors for periodontal disease would then be supportive of that veterinarian's recommendations to move forward with a dental cleaning. Maybe this opens the conversation for you for those owners or caregivers who are terrified of anesthesia, they don't want to do an unnecessary procedure, and you can tell them, hey, look, we've got this result that tells us your cat is at high risk. There's a big chance we're going to have development of tooth resorption, periodontal disease. We've got to get in there and reverse that disease process. What else is cool is these tests also work for down the road after you've performed a dental cleaning, and you can actually re-swab them and show that the oral microbiome has gone back to low risk for periodontal disease. And so that's really giving that caregiver value for that dental that they just invested in for their cat. So currently, feline medicine research is constantly evolving, and the specific area of microbiome research is also growing as well. And we need more samples to expand this database. And so that's where all the veterinary practitioners come in. There's a number of ongoing research projects right now, and BasePause is actively recruiting progressive veterinary hospitals and partnerships. And up here on the screen, you can see there's several different studies that are going on, many different organ systems from the kidneys to the gastrointestinal tract, endocrine disorders, and even dermatologic. Our clinic right now in Columbus is collecting samples for a CKD study. And I have to tell you that when I start talking about it with owners, they get pretty excited, and I have yet to have anybody decline enrolling their cat. And it's really just donating some genetic information. And again, with such a gentle test and fear-free method of collection, it's not hard to do. And so if any of you guys out there today have never participated in any research study or clinical trial, I highly encourage that you consider participating with one of these research projects. Not only are you helping to promote and further data collection and research in veterinary medicine, but when clients learn that their vet hospital participates in research, and especially something cutting edge like this, it really can elevate their view of their veterinarian and increase compliance overall. So if you're interested, there's a email address on the screen. You can give them an email, let them know that you're interested, and we can match you to a study that would fit with your hospital. And that is it. So I am going to stop sharing my screen, and then I can take some questions.
Perfect. Thank you so
Yeah,
much,
I see.
Ashlie. Apologies if you guys can hear my dog barking in the background here. Hopefully he calms down in a moment. But thank you so much, Dr. Saffire, for helping us just to understand the significance of CKD and feline health and why we should be detecting this earlier and earlier for our patients. We do have a few questions from tonight's audience. Just as a reminder, if anybody does have questions, please go ahead and put them into the question and answer box. It does look like we have a couple coming in here.
I see a few in the chat also.
Yep. Does microbiome testing need to be done frequently due to normal changes in the host, or would it remain stable in each patient throughout their life?
Yeah, that's a great question. So it does change. It changes based on many different things. It's what stage of life they're in, what their current health status is in. And so with the dental microbiome test, it's a great way to get a starting point. And I think a really good one is you get a new owner or a new caregiver with a new pet, and they come from a shelter, or they recently found a pet, and you want to know the health status of this cat. And so you swab the mouth, you find out, hey, he's high risk for periodontal disease. Let's get him in, let's get a dental prophy. And then at that point, you would maybe swab him every 6 months to a year. Maybe it's every annual exam. They come in, you do a swab, and you see how that cat's doing. Because as disease progresses or as things change, you're going to see those changes in microbiome. But a low risk microbiome is great. And that tells the owner, hey, you've been doing a great job with home dental care. Keep it up,
Absolutely. The next question here is, what's the time frame to get results back?
So it takes about 4 to 6 weeks. And the reason for that is there's a lot of DNA extracting. It's a very intense process, and so it does take time. So that's the one thing to remember when you are doing these swabs and we send them out. It can take about 4 to 6 weeks. We usually err on the side of overestimating so that the owners are pleasantly surprised when it comes back sooner than expected.
Awesome. We have a couple questions here just about the availability for partnership. Is that available also to practices in Canada, or is that US only?
So that'd be a good question for BasePaws, because I'm actually not sure if that, I'm not sure. I think I see Tanya.
I can answer that. So the research opportunities are a little bit different. There's no cost to participate in research. In fact, in some cases, BasePaws pays you. So we provide all of the sample collections and everything free of charge. And because you're not actually buying the product, you're participating in research, there may be opportunities to participate in research from our friends with our friends in Canada. I dropped a link in the Q&A. You can actually go to basepawsvet.com/research-register and sign up, and our research coordinator will reach out to you to help you get started and to answer your questions. And you'll also see on that page, there's a wide variety of projects that we're working on. So we're focusing strongly on CKD and some dermatology and some arthritis studies right now. So if you feel you have candidates for that, please sign up. If you're interested in purchasing these tests for your practice, there are a lot of veterinary practices that are starting to bring on genomic testing and as an early prediction tool, and then just as a value add to a wellness program. Those are available through veterinary distribution. So they're available to order from MWI Animal Health or Midwest Veterinary Supply right now. Others are coming later. And the cost, we have a canine test as well. And then the feline, and that includes an oral microbiome, and then the oral microbiome as a standalone. They're less than $100 per test vet cost. So you can log in, ask for more information from us for specific pricing, or log into your distributor to see the actual product if you'd like to purchase.
And everybody attending the webinar tonight will get a follow-up email tomorrow that directs them to more resources from our friends at BasePaws as well. And one of our attendees here tonight said that their 3-year-old cat is actually current in the BasePaws study for CKD. So really excited to have them in the audience tonight as well.
That's awesome.
It does look like we have one more question here from an attendee, and just wanted to know, how do we know that the oral microbiome predicts the CKD and it's not the CKD changing the oral microbiome?
So that's a good question. So I think that comes down to that we know there is some overlap with some of those microbiome. And so when we're doing, and what the CKD test is showing us, we're looking for those 23 microbial signatures that are only present with CKD. And that's been done. There's been studies so far, this is where we need more and more data, that the cats with kidney disease were compared against those who are healthy. So they didn't have evidence of periodontal disease. They didn't have any systemic diseases. And that was how we were able to get those very specific 23 signatures that are found with cats with only CKD. But there is a lot of overlap. So that can be hard, that chicken or the egg. And so those ones that are overlapped, we just don't really know.
That's exactly. So like I was just actually texting with one of our veterinarians and researchers, and the truth is we don't exactly know yet. Like that is still being investigated. But the point being is that no matter how you got there, the benefit of being able to detect that a patient is at high risk because of the microbial signatures or those specific microorganisms that we're looking at, you know, the end result of being able to detect that is you're going to look at that patient a little bit differently and be more proactive about what you're going to do for the lifetime of that pet. So having the knowledge of those is the most benefit for that pet.
Yeah, absolutely. Thank you so much for that clarification, Tanya from BasePaws, as well as Dr. Ashlie Saffire. Thank you, everybody, for joining us for this webinar this evening. As always, Fear-Free webinars will be posted, open access to Fear-Free Pets. So the recording of this webinar will be available generally within 2 weeks at fearfreepets.com. And the race certificates will be emailed to all attendees within a week following this presentation. We did have a couple more questions about availability outside of the US, and we will let you follow up with the BasePaws team directly. Again, we will drop that link in the chat, and we will be able to send that out to everyone following this webinar. So you'll get that email tomorrow. So thank you guys so much for joining our webinar this evening. We hope you all have a wonderful rest of your night, and we will catch you next time.
Thank y'all.
Take care,
Thanks,
everyone.
guys. Have a great night.